I am Dr. Zain Gulzar, currently working as Assistant Professor in the Department of Medical Education at Watim College, Jawad, Rawalpindi, Pakistan. The topic of my presentation is From Assessment to Wellbeing, a multi-stakeholder evaluation of first-year BDS students' outcomes. The rationale of our study is to present an in-depth analysis of these findings, offering evidence-based insight and actionable recommendations to enhance the educational experience and academic outcome of first-year BDS students by integrating multi-stakeholder feedback. The study underscores the urgent need for specific interventions that promote a more supportive, engaging, and effective learning environment. The learning objective of this study were to evaluate the academic performance of first-year BDS students through a multi-stakeholder analysis, incorporating perspective from students, faculty, and academic administrators. To identify key challenges, both academic and non-academic, faced by students during their first year in the BDS program, including workload, adaptation to the curriculum, stressors, and access to support services. And third is to propose actionable recommendations based on stakeholder feedback to enhance academic performance, strengthen educational support system, and improve the overall first year experience in dental education. It was a mixed method study. A universal sampling technique was used. All 51 BDS students were included, and data was collected from faculty, student department, examination cell, medical education department, and the principal. For qualitative data, structured interviews were conducted from the selected participants, and for quantitative survey forms were used. Exclusion criteria include students who didn't appear in the examination and faculty was not directly associated with first year teaching and examination process. From the studies are assessment clarity, teaching effectiveness. From assessment clarity, the challenges were lack of organized approach and manual tracking of attendance. The recommendations are the optical mark recognition to be introduced, faculty training in item construct and analysis. Third is assessment-oriented dental education and digital tracking of attendance. The challenges related to effective teaching were lack of workload distribution, non-serious attitude of students, low attendance of students in tests and lectures, lengthy curriculum, and shortage of time to cover the syllabus. The recommendations are audiovisual presentation, adoption of the classroom technique and PBL introduction, training session on innovative teaching methods and internet and IT facilities in lecture halls. Other things which were identified are infrastructure gaps and need for improved student engagement. The challenges related to infrastructure gaps were limited access to internet and IT facilities, uncomfortable seating arrangement in lecture halls. The recommendations are upgradation of IT infrastructure and lecture hall facilities and availability of online portal and access for students. The challenges related to need for improved student engagement were favoritism and time management. The recommendations are frequent and effectiveness of parent-teacher meeting, including parental concerns and their resolution, greater encouragement and support from the teaching faculty, introducing mentoring and student support system, personality development of students through motivational talks by renowned speakers and faculty members, and provision of psychological and counseling support system for the students. Here are the results. 61.5% students perceived that the teaching quality was good, and 48.7% students responded that the primary reason of low attendance was their personal reasons. Our findings are supported by the literature. Mentoring, psychological support services, and parental involvement emerged as influential factors in student well-being and academic success. Parental involvement in particular contributes positively to student self-regulation, engagement, and achievement motivation, thereby forming a crucial part of the broader education ecosystem. It is also identified that active learning strategies such as problem-based learning and flipped classrooms offer promising alternatives to traditional lecture-based methods, yielding positive outcomes in university-level education, particularly in boosting motivation and learning efficacy of our students. These are the references. Thank you so much for your time and consideration. Take care. Allah Hafiz.